Now, starting with the forehead, right? I see the lines, Lori, I see the horizontal lines, I see the vertical lines, and those are now etched in. So it will be really hard for any neuromodulator like Botox to do a whole lot, because that type of treatment is meant for dynamic muscle movement, not so much when you have, static lines. So the dynamic lines that you can definitely do, well, with the Botox, but once those lines are etched in, it's tough. Like you said, you have to have a lot of the stuff, and they keep coming back for it. So I get it. Now, it's interesting because I find that for a lot of patients, the medial eyebrow actually stays put. It doesn't droop that much over time. And that's been supported with different studies. The lateral aspect does droop as we age, because this whole fat pad over here, temporal fat, starts to atrophy, and there just isn't as much support out here as there is here, okay? So the lateral eyebrow droops more than the medial in most patients. Now, in some patients, there's drooping both medially and laterally. It's less common, but I am seeing a little bit of that with your situation. If anything, your medial brow is at a lower kind of vantage point than the lateral. And that, again, is more unusual. Usually you're kind of seeing this with age.
Right.
And the lateral needs to get lifted, and then they're at a pretty good level. In your situation, because the medial has dropped, I think you need more than what I typically do. Typically, I like lateral brow lifting. I find that it's much more effective than just doing everything. It's less traumatizing, and it kind of gets to the main problem. But in your situation, I do think that medially you can use some sort of lift, as you kind of pointed out. Will it completely smooth out these vertical lines and the horizontal? Probably not. I would not promise you that. But it should make an improvement, and I would recommend a resurfacing treatment, such as the Fraxel, or something like an Erbium or a CO2, a little bit stronger, that could also help. Because again, once it gets so superficial, it's very hard to completely get rid of these lines with surgery.